Welcome, everyone. Welcome. If you're here for the Balance Eating Disorder Treatment Center webinar, the Med Spa Minefield, the link between beauty treatments and body dysmorphia, you are in the right place. I wanted to basically have two leading experts here today who are going to shed light on an increasingly significant intersection between cosmetic procedures and mental health that you may be seeing in your everyday, maybe even in your practice. I'll be your moderator for today. I'm Alina Sheikh. Feel free to throw in the comments where you're located in, where you're tuning in from, your practice, your clinic, things like that. I'll go ahead and move forward, speaking more about balance. I wanted to introduce our organization and what we do here. Balance Eating Disorder Treatment Center has been at the forefront of eating disorder treatment and body image recovery for over 15 years. We've seen firsthand how the intersection of appearance-focused treatments can make a strong impact on mental health. Tribeca Skin Center, our partner for today, who will be joining us later on, presents a simple, intelligent, and dedicated approach to skin health. All medical and cosmetic appointments are with board-certified dermatologists who help their clients protect the skin they have and achieve the skin they want. Our host expertise in this area make them uniquely qualified to help us navigate this discussion. Moving forward, let me introduce our host for today, Melainie Rogers, who founded Balance Eating Disorder Treatment Center and has spent over 25 years on the front lines of eating disorder and body image treatment. As a certified eating disorder specialist, registered dietitian, and NYU professor, as well as IDEP mentor, she provides guidance to clients, loved ones, and clinicians in redefining recovery. Joining her and joining us later on will be Dr. Sherwin Parikh, leading dermatologist in New York City and founder of Tribeca Skin Center. Dr. Parikh brings the perspective of a dermatologist and skin center owner who has witnessed firsthand the patterns that we'll discuss today. Together, they offer key insights into this conversation. Now, just as a reminder, for those seeking CDR continuing education credit, please note the requirements on your screen. You will need to attend at least 75% of today's live session, complete the evaluation within 74 hours, and score 75% or higher on the knowledge assessment. Your certificate will be emailed within 24 hours of completing these requirements. If you're watching us on YouTube on our webinar replay, you will not be eligible for CE credits at this time, but you can join us for our next live session. Our webinar access code will be placed in the chat below. I'll go ahead and pin Dr. Parikh here and leave it off for Melainie to go ahead and start.
Thank you so much for that welcome and introduction, Alina. And hello, Dr. Parikh. Great to have you joining us today. Thank you so much for taking the time out of your busy day. And I'll just unmute.
Now I'm unmuted.
Yep.
Thank you. You're welcome.
You good? Great. Great to see you.
You too, Melainie.
Thank you, everyone, for joining today on what is a very important topic that has come more and more to my attention. Med spas is the new normal. Before we jump in, though, I wanted you to know that I had invited my own dermatologist, Dr. Sherwin Parikh, to join me in this important conversation. The reason I did that is A, he's fabulous, and B, when I was having my own moment of concern around the aging process, as I think we all do, you were so warm and so neutral, Dr. Parikh, with that conversation, and actually said to me at the time that aging naturally is very beautiful. And it took away so much of my anxiety. And it really has stayed with me. So I just thought, who better to come in as someone that we can soundboard than yourself? So I'm so grateful to you. For our audience today, I also want to start off by saying we are definitely not anti-med spa and we're not anti-procedures, but rather what I really wanted to, or attempt to do today, is to try to join some dots between the proliferation of med spas that we're seeing out there in our very own communities, the Oh, absolutely. Impossible beauty standards that we are seeing through the use of filters on social media and Zoom, and the crossover of those two areas with our own vulnerable clients who are coming to us for their own mental health concerns, and often body image distress is a big part of that. So that's what we're attempting to do. I hope we're successful. So first, why don't we start by looking at some numbers here. These are some stats from the MedSpa Association. They only have statistics up until 2023, but you can see that within a 5-year period, the number of med spas in the US of A has doubled. And I would hazard to say, I think that we probably have far more than that that's listed there, around 10,000 in 2023. In fact, yesterday, as I was thinking about this webinar, I was walking around my neighborhood, and on my block alone, I'm here in New York City, there are 3 med spas in just one block. It's crazy. So they're out there, they're everywhere, and the question is, what exactly are they? So let's have a look at our next slide, Alina. So med spas are a place, I didn't even know this term until recently, where medical procedures are done in a spa-like atmosphere. And if you've ever, peeked in the windows of some of the med spas, you definitely do see that vibe. Common services that are offered: Botox, derm fillers, chemical peels, laser treatments, body contouring, injectable treatments, often though with varying levels of medical supervision. One thing that I wanted to point out that made an impression upon us as we were thinking about this topic is when you take a medical procedure and you deliver it in a spa-like atmosphere, it sends a different message. When you're going to your doctor or your dentist, and it's in more of a medical setting, literally, there is an element of seriousness to that procedure that, okay, this needs careful thought. I need to make sure that my doctor knows what they're doing. You fill out your questionnaires, etc. When you go into a spa-like atmosphere, I don't know if you can, if you kind of think of yourself in that arena, there's something about the procedures being done there that feel a little bit more like self-care as opposed to a medical procedure. So there is a difference in the way we're perceiving it. And I think that's really important because as it becomes more normalized, we want to be thinking about where is there a line there with this accessibility and this normalization. So let's go to actually, and Dr. Parikh, I wanted to ask you yourself, how do you differentiate your dermatology practice from a typical med spa experience?
So that's a great question, Melainie. And we've always held to it here at our practice that you are being seen by board certified dermatologists.
Right.
So that's a very specific thing. People who've gone through 4 years of med school, a year of internship in medicine, 3 years of specialization in dermatology residency in programs, and have completed their board examinations and continue to do their continuing medical education and maintain that certification on a yearly basis. All that's to say is that even though someone may be coming to us even just for a tiny wart on their foot that they want to have frozen off, or to check for skin cancer because there's skin cancer in their family and they grew up as a lifeguard, and it doesn't seem like it might be a dangerous thing to have that done by just a nurse practitioner, um, at least for us, we prefer that that's the way to deliver our care. There's nothing wrong, I suspect, because laws have allowed many non-physicians, non-MDs to do a lot of these procedures. So there must be something to that, or have these kind of examinations. But to your point, where there's varying levels of medical supervision that you mentioned, you do worry that even though a physician can not always be perfect, you feel as if we're held to a bit of a higher standard. So we want to fulfill that standard for people, both in the services delivered, the care given, and the amount of information we can disperse as well about everything.
Absolutely, absolutely. And I think that's a key thing, the level of training, the regulations that you must adhere to, the ethics, of course, as well, etc. So no, that's really terrific. Thank you for that, Dr. Parikh. So as we go to our next slide then, and we talk about what we're seeing out there on social media, and my social media team, Alina and Amanda, actually were the ones who kind of put all this together for me and showed me what was out there. And I was pretty surprised. We intentionally made this slide to look like an advertisement because that's a little bit like what we are seeing on social media. And I wanted to draw your attention to a couple of things. First and foremost, that the industry is actually using this word tweakment. It's a real thing. And the idea of it is that small changes, big impact. I also want to draw your eye to some of the language that's being used. Just a little something, barely noticeable, lunch break procedure. So that language, to me anyway, minimizes the seriousness perhaps of those procedures, or the idea that you might regard them as normal or minimally invasive, as perhaps having your nails done at a nail salon. Another piece here that's interesting is the proliferation of the messaging through hashtags such as Tweakment Tuesdays, lunch break Botox, and of course minimally invasive. And the one that got me, and I actually did some more research on it, was something called Botox brunches. It's a real thing. Some med spas will sell a package called a Botox brunch, whereby you can either come into their spa or they'll come to you with a couple of technicians, a box of Botox injectables. They also will provide food and the beverages, champagne, etc., for a whole brunch. I know I'm laughing too. I'm thinking, who does this stuff? But apparently they do. So I don't know about the idea of doing injectables while you're drinking alcohol, but nonetheless, it actually exists. So that's just to give you a little bit of an idea of what's out there on social media around this. So why are we talking about this? Myself being an eating disorder professional, and many of you joining us today, why are we talking about med spas and cosmetic procedures, etc.? And the reason is because there's a shared overlap in the patterns. We've got body image disturbance, which we see in almost all of our eating disorder clients, overlaid with perfectionism. Then we have clients who are very dependent on external validation, and via control-seeking behaviors is part of their mojo. And so if you think about that with our eating disorder clients, we have the same roots, but perhaps different branches. One is focused on body image control through an eating disorder and restriction, and another is going to perhaps compulsive cosmetic procedures and seeking that. What I'd also like to say is not only is there this shared pattern, but I'd like to suggest that with the proliferation of med spas and what we're seeing with these filters on social media and people's distress in their appearance that we're seeing a significant uptick in, we're actually going to see an overlap. In other words, our eating disorder clients are going to start seeking more and more cosmetic procedures, and we're already starting to see that. The reason why I think this is an important conversation is because I know us, for example, at Balance, we haven't necessarily been asking our clients about those appearance-seeking behaviors until recently. And I think that it is a really significant red flag that we can start to be having more conversations about. So when I'm talking about body image distress, just to kind of give you a sense of how we view it across the spectrum. On our left-hand side there, body positivity. And I have to say we are so proud in our industry and in the general population over the last 10 years, how much progress has been made around the idea of body positivity, anti-diet culture, etc. The idea of diverse body shapes and sizes and celebrating that. Unfortunately, with GLP-1s, Ozempic, etc., coming out in the last couple of years, I feel that we've got whiplash where we're very, very, very quickly gone straight over to the right-hand side here, where we've gone to not only body image distress, but I would say outright loathing. And it's been honestly really, really sad and disappointing to see how quickly it felt as though the body positivity movement was undone. But I think it also just speaks to the enormous amount of social pressure out there around appearance. So as you look over here, body dysmorphic disorder is a particular subset of body image distress that we in particular want to focus on today. And clients with body dysmorphic disorder have persistent obsessive focus on perceived flaws, significant distress around those, and impairment to the point where they may stop going out. They may stop socializing. They may not be able to get out the door because they can't go out with, a certain flaw that they're seeing on their face. And the flaws of note may be minimal or honestly not even visible to others. So we're really seeing a significant distortion. We know in the mental health field that we know that there are areas of the brain that are literally seeing a distortion almost in the same way. I often use this as an analogy. Functional MRIs have looked at the brain of someone with schizophrenia. So someone with schizophrenia may hear or see things that literally do not exist, but to them, they do because they're seeing them, they're hearing them. So their experience is real. And they're found with our clients with eating disorders who have body image distress, the same area of the brain is lighting up in those functional MRIs. So that tells us that that area of the brain is not functioning appropriately or is dysfunctional in that moment. That means that no matter how much you reassure that person that they're okay, they're fine, they look great or whatnot, they're never actually going to be able to move beyond that fear and that distress because of what's going on in the brain. So BDD, a couple of numbers. The numbers certainly tell the story. BDD in the general population, about 3% of the population struggle with this disorder. And as a comparison point, the lifetime prevalence of folks with an eating disorder, a full-blown diagnosable eating disorder, is around 9 to 10%. And certainly there's overlap between the two populations. Among those with a BDD diagnosis, it's probably no surprise that up to about 76% have had some kind of cosmetic treatment. It totally makes sense with that level of distress. So what that means is in any aesthetic specialty, any centre, about 14% of the clients are clients with BDD. And I don't think that's a big surprise. That's according to one research paper. BDD, when perception becomes reality, our clients will say, I can't stop seeing it everywhere I look, this perceived flaw. And if you think about it, the behaviors that we hear our clients talk about is every reflective surface is basically a mirror. So, walking along in front of shop stores, they're checking themselves in the reflection of the windows. They're checking themselves in their own mirrors, of course, any reflective surface, and spending excessive amounts of time doing so. You'll see here with key characteristics. In some studies, they're quoting up to 3 to 8 hours daily hyperfixated on these perceived flaws in the mirror. And as you would imagine, significant stress, and I don't know how anyone could keep down a job or, go to school and keep up with studies with that amount of time dedicated to this particular area of distress. And then came along Zoom. So with COVID, as we all know, many of us pivoted, and for the first time in our lives, I think for most of us, we were on Zoom all day and looking at ourselves all day in a way that we never had. And I wonder what you saw, Dr. Parikh. I'm just throwing this one out because I remember so many people were using their own filters on Zoom. And I believe I read in, New York Times or something that a lot of people were getting neck work done as a result of this Zoom face phenomena. Is that something you saw?
Absolutely. Consistently. And so what I was able to quickly establish, we spoke about this as a patient today in the office. It came up as well, the Zoom, because the Zoom calls are still happening and people are still working on it, is that there is something to be said. I haven't fixed the problem right now. To be even elevating like this and changing the angle to make your neck look better. These are unnatural. I'm able to easily tell someone it's not a natural way to be seen in this viewfinder. So immediately if someone complains, I said, I see, I hear you're complaining. We don't love Zoom, but be aware that the angle fixed and strangely head on isn't correct. People are seeing you in motion. People are seeing all of us from different angles and different lights. We don't get that with the 30, 40, 50-minute Zoom call. You begin to also minimize. I've currently kept my window tiny in the upper left. I won't look at myself. But again, these are just habits that I would train anybody who is getting concerned because of Zoom. Now, when we're in the office, let's look and see. And I can easily say, yes, but that's not really a thing. Or I see, were you seeing it before Zoom? Okay, you were. Remember, Zoom isn't real. In fact, even what we're seeing on our cameras isn't real. And luckily, a lot of people that I see here at the office are able to kind of quickly adapt and go, you're right. It's just not. What I'm seeing is what I'm interacting with you across a dinner table or across at a cafe. That's real life. This is not. Anything can be shifted just by putting your laptop 2 feet up. That is not real. So do not worry. If you really want to talk to me about something or something, we can have a chat. But let's not make Zoom the focus. So we pull people away from that. I said, minimize your screen. Don't look at yourself up in the upper corner. Look at the screen, which has the large slides, and look at the presenter. Pay attention to other things other than yourself. It's an easy thing to say, like I just said right now, on a regular basis, and people then shift for the moment. And if they don't shift, you're right. There's something else going on.
Exactly. Oh, I just love that. I love that. And it's so true. And and again, reflecting back on what you had said to myself as well, your word carries so much weight because, this is your area of expertise. So I just think that's fantastic with educating them and really speaking to that distress and reassuring people it's not real. Love that, Dr. Parikh. So as you can see here, we've got this perfect storm where BDD meets med spa culture. We've got our BDD client saying, I really need to fix this floor, enormous distress around that, enormous urgency. We've got med spas potentially saying, or many saying, perhaps we can fix that. And there may or may not be screening going on there. And then we've got, of course, social media. We've got Zoom saying, or we've got social media saying everyone's doing it. And that normalizing language that we were speaking about earlier. So the result for our BDD clients is escalating procedures, more and more procedures, procedure seeking, yet not a decrease in distress, an increase in distress. And we'll have a look at what that means in a moment. But for you, Dr. Parikh, I wanted to ask, when you encounter a client who seems focused on a flaw that you can barely see, how do you handle that consultation? What do you do?
I think to your point, I start off by admitting that I can barely see it. There's nothing wrong with me being imperfect to not see the flaw that is an aesthetic problem. Even if I really do see what they're talking about, but I worry that there is something tending towards BDD, I'd like to pull them away from that and say, listen, I don't really see it. But to your point, you worry, will they go to somebody else and have them say, well, I see it, and then they get it fixed. So how do I pull them away from that? It is difficult. It is difficult. But I do think that because we lead here at Tribeca Skin Center with the medical, which is to say, let's make sure there's no skin cancer on your nose because you're Australian and you grew up getting loads of sun or you were a lifeguard. We lead with the sort of quote unquote important things first.
Yeah.
And we're all physicians, so we build a bit of trust in the fact that I have seen you. Needs to be biopsied. That might be a skin cancer. And then the follow-up about the flaw that's aesthetic, we can say, sure, potentially we should fix that, but let's put that off. Why don't you take a pause and see if that's something that really is that important?
Yeah, I love that. I love that because as you know, with the BDD client, there's an impulsivity because the distress is so high. So slowing down the process, take some time to think about it, I think is a fantastic approach. So here, let's have a look at this escalation pattern. So stage 1, minor tweak, some temporary relief, but short-lived. And then we go to stage 2, just one more thing, relief fades quickly again. And one thing I want to point out here with BDD, and this is in the research as well, that our clients with BDD put attach an unrealistic expectation to a procedure. And often what they're looking for is not just a procedure to be done to feel better, but the procedure to also fix other problems in other areas of their life. And so inevitably, there's going to be, unfortunately, disappointment, because no procedure can ever do that. So stage 3, we've got more increasing desperation. Stage 4, nothing helps, and often leading to clinical depression and anxiety. My question to you, Dr. Parikh, is, are you seeing this kind of escalation? Are you seeing clients who maybe have gone elsewhere and are now turning up to you at different stages?
I may be luckier in this, in the sense that I don't see it as much, because at that stage 2 that you've identified, as a physician who's not just trained in general medicine, but also dermatology, and who rotated through psychiatry and knows many people like yourself who are so adept at their fields, who give me information back about this. If I'm at stage 2 and relief fades quickly, we're not going to go to stage 3. We're going to stop, right? That is when I, as a practitioner, should know that the thing that should have made you feel relief or should have fixed your issue should have been the thing that made you a bit happier. And if I can see anything that needs if the person says, let's do something else, let's have that desperation, I have to stop at stage 2. And we say, you know what, you've spent enough time, money, and effort. I don't think that it seems to me that you're not as happy as I would have expected you to be, which is totally fine, but we shouldn't continue. And I guess it's a function of, again, having been a dermatologist for 20, 25 years, that I myself don't need to be desperate to keep them doing things. Because that stage 4, that clinical depression anxiety that you mentioned, I have a belief that may also already be existing at stage 2.
Yeah.
But it hasn't been yet uncovered.
Yeah. Absolutely. Absolutely. I love that. And it speaks also to, I think, Dr. Parikh, the kind of rapport and trust that you build with your clients, so that, again, when you're having these conversations, they are influenced by that, and they're really hearing what you're saying. I think that is so key, so key. Where some red flags in practice. So you out there, our audience today, in your private practice, at your treatment centers and such, what can you be looking out for? So these are a couple of flags that have been recommended. When your client says, everyone notices this flaw, and you may not. Immediately booking a procedure after identifying new concerns. And you may only uncover this through actually having some of these conversations with your client. The third flag, multiple procedures with minimal satisfaction, which we just looked at. And also, if a client's bringing in filtered photos as goals of how they desire to look. And so I'm asking for you, Dr. Parikh, of those red flags, which one do you most commonly encounter?
I encounter number 3, multiple procedures with minimal satisfaction before they've come to see me, right? Now, I should not be the one that does multiple procedures with minimal satisfaction. Even if I'm at 1 or 2 and I'm sensing minimal satisfaction, I have to, I have to start to readdress how I'm behaving with the patient, or how the patient's behaving with me. Immediately booking after identifying new concerns, I suspect, at least in my practice, in general, people have thought a lot about it. We've had a conversation, so the immediacy isn't the issue. Bringing in filtered photos as goals, I guess I'm lucky enough that people who do bring in the filtered photos will also acknowledge they're bringing in a filtered photo, and they sort of say, I know I can't really have glass skin, but like, how do I get glass skin? And I say, well, that's a term that's recently made up. And let's talk about what people think that they're getting when they do it. You know what I mean? And try to steer towards good skincare and healthy habits. And if people find that that's good enough, they'll stick with that.
Yeah, great. That's terrific. And our next slide. So let's talk a little bit about Instagram face then, which is, part of what is driving this with the different filters. So there is a thing called Instagram face syndrome. And we looked at one particular research paper and it looked at women between, actually mixed group of men and women between the ages of 18 and 30. And they found that 90% of those folks were using a filter or editing their photos regularly. 94% of that particular cohort said that they also felt under pressure to look a particular way. And then in another paper that we looked at in kids between the ages of 13 and 21, we found that one in five of kids between 13 and 21 are using filters on every post. And 61% of that cohort said that using filters makes them feel worse about how they look. So that's just a little bit of, just a sampling of what we're seeing out there with the use of filters and how people are feeling in response to that. Thank you. So the professional crossroads where there's potentially competing responsibilities, right? We have the client requesting, I want this procedure. We then have the professional ethics of, do no harm. I would also like to offer another legal consideration that also came up while we were doing the research around this topic. And that was that when clients felt that they weren't as satisfied with the procedure as they thought they were going to be. And remember, with BDD, we established that's almost impossible to be truly satisfied. Then some people, again, out on social, were then hyper-focused on the new flaw that was a result of a surgical botch, so to speak. And so then it became this hypervigilance around that. And actually, it was pointed out that there might, as difficult as that is for that particular person to have experienced that, there may actually be some relief in the sense of blame and shame of there's something wrong with me now gets moved to the surgeon messed this up and it's the surgeon's fault. And now it's kind of externalizing that distress. A very interesting little kind of phenomena that is being observed. But also, and I worry about you, Dr. Parikh, well, not you, because I know that you screen well, but if you've got clients who are coming in who are never going to be satisfied because they're struggling with BDD, then I worry about the legal implications.
I personally, to your point, I think that it's more about surgeons who may be doing something a bit more drastic and more side effects. Listen, it has to come up even when I'm prescribing a young person or Accutane, for example, which for some people is a life-saving kind of in quotes, but quite frankly, people who have terrible cystic scarring or calcineurin acne, we've had this medication for long enough that we know that if it has side effects. So I want them to read the list of side effects. And I want them to be willingly partaking in the screening once a month and a blood test once a month and make sure. If this happened today, I just saw a patient, she's early 30s and finally finished her course and said it was great. She wishes her little sister would take it. But she's worried that both her little sister and her mom believe that it may cause another problem later in life, like suicide or so to your point, am I liable if this goes wrong? It is a consideration, but we have to be both sort of mutual partners deciding on the therapy being good for somebody. She herself thought it was the best thing she ever did, and she wishes her little sister would take the medication because it's changed how she feels. But she also understands that if her skin becomes, she herself said this to me about her sister. If her skin, she worries that if her sister's skin becomes better to the point like hers would, her mother even remarked how beautiful her skin was. But if her sister's skin becomes better, she might have to actually worry about the other things that are really wrong in her life. And that would be trouble.
Absolutely. You hit it on the head there. Absolutely. So, Dr. Parikh, with these enhancements, and again, our theme here today is we're not anti, people, doing procedures and wanting to feel better, etc.
No.
Right?
Yeah.
When, in your mind, when does enhancement, though, become harm? And do you have a sense of that?
Enhancement becomes harm when we can physically see that the skin, for example, is straining under the technique that we're doing, right? If the lips have become too large, they are distorting speech. If some, you can see it in people, and enhancement becomes harm. I think when, as you said before, it continually makes someone want more
Yeah.
and more, as opposed to at a certain point saying, "This has been great. I will see you in 6 months. I'll see you in a year. I'll see you in a year and a half." So they can go ahead and live the rest of their life happily, having fixed the thing, just like getting a haircut and feeling
Right.
better about their life for that. You'll have to go back. We understand that, but let's do it in moderation. Yeah. Yeah.
I love that. I love that comparison there with the haircut. Absolutely. So, some screening tools then that you all may consider using with some of your clients, and we certainly are going to be adopting these as well at Balance. So, just three really simple questions. For example, how long have you been considering this procedure? What do you hope this will change in your life? So we're trying to get at some of those underlying key concerns that have been somehow hyper-focused onto that perceived flaw. And how much time do you spend thinking about this area daily? When I was thinking about these questions, what came up for me is back in the day, 20 years ago, when I first started out as a nutritionist, I was working alongside a surgeon who was doing bariatric surgery when that first really was kicking off, with the lap band that had just been FDA approved. And it made me think of those clients who felt that via the weight loss, and for many it was, medically very helpful, but they truly thought that so many areas of their lives would improve as a result of this procedure and this weight loss. And many became quite depressed afterwards when they realized that actually not a lot of things were suddenly went away, or the issues that were bothering them or in their life suddenly just didn't disappear. That yes, medically speaking, maybe there were some improvements for them, but other issues remained. And it brings up the same kind of idea here, I think, Dr. Parikh. So for yourself, do you have screening questions or tools that you use at Tribeca Skin Center?
Exactly that. How long have you been considering this procedure is a very, very good one. And we ask that question all the time. Uh, what do you hope to achieve? Is a more of an open-ended question, as opposed to for us changing your life. And I think we may incorporate the how much time do you think spend thinking about this area daily? That might be a good third one, because the first two are always things that we ask. Correct. Yes. But what do you hope to achieve with this, or how do you think you want to feel afterwards or look afterwards and make you feel, let me know. Yeah.
Oh, I love that. I love that. So that brings us to referring, right? So if your clients are indicating behaviors, thoughts, distress, etc., what do you do then? So, and some of the key or clear referral indicators for additional support would be, number one, unrealistic expectations that persist after educating, right? So Dr. Parikh, you were talking about how you go through your education process with clients, even with the Zoom neck, moving things around. But if unrealistic expectations continue, that's a red flag. Multiple procedures yielding minimal satisfaction, as we spoke about. Number three, significant life impairment from appearance concerns, and then that depression, anxiety spike, or actually probably just more of a manifestation of that. So those are clear referral indicators for anyone in our audience that a client may need a referral to a therapist if they're not working with one and they're working with you as a dermatologist, or vice versa. If we're working with our clients in our mental health clinic and we're seeing some of this, my go-to would be honestly to send them to you, Dr. Parikh, so that you could, really have a look at some of these underlying concerns and talk to them from a medical perspective.
Yeah, and out of the four dermatologists here, I think every day out of the four of us, we are referring a few patients every day to licensed psychotherapists, just as a matter of course, because people are open to it. It's just helpful for their lives, right? We all need that help at some point in in our lives. Just like we want to see a physician for a blood pressure, cholesterol check, it is good to check in with a therapist if you know that things are just not right. And so we on tribecaskincenter.com and we like that because we feel like it's a great thing that people should avail themselves of if they can.
Oh, I just love that. I love that. And our next slide, Alina, is exactly that. So who do we refer to, but also who do we need in our network? And again, I think, people are hearing that for us at Balance, including a dermatologist in our referral network is now an essential part of what we're doing. And we've not done that before, to be honest with you, Dr. Parikh. We haven't
Oh, okay.
um, because we haven't encountered this to the degree that we're starting to. And so, but now, and also because we're going to start screening for it, we definitely want to have, for yourself as a trusted dermatologist that we would refer to. So for our audience out there, a dermatologist, I would like to say, is now an essential part of our eating disorder treatment team. A therapist, of course, and particularly one who specializes in BDD, if that is the presentation. Our psychiatrists, of course, eating disorder specialists, and then support groups for body image can be incredibly helpful. And our thought process is to build your team first, know who some key people are that you really trust, that you've vetted, so that should the occasion arise, you've already got people that you've met and know and trust to refer your client out to. And so, Dr. Parikh, with regard to your referral network, it sounds as though you're already actively referring out to psychologists, which I just find is fantastic. And so that answers my question. Have you had to refer out? And you do daily.
Yeah, it's not even a have to. It's a desire, right? I would want that same thing told to me if I were in need. Someone saying, not just a friend saying you'll be fine, but let's go see someone who can really sort of sort out the issues, who's a neutral third party, who's trained in that, just like we're all trained in our own specific fields. It's super, super valuable. And I think the stigma has been taken off, at least in New York City, about seeing a therapist. It's
Yeah.
just access that becomes the problem.
Yes. So
And, and luckily for us at our practice, we take multiple insurances for even the things that are medically related, not for the cosmetic treatments, but so as a result, there isn't that much of a barrier to see us if you have, terrible eczema or something or terrible psoriasis. But how much is it related to other issues? We try to sort out. What is your dietary pattern? What is your sleep pattern? What is your home life? And could you have other avenues besides just us as dermatologists providing you with creams to get your skin better to also help the rest of your life get better, your health get better?
love that. Love that. A script, people often say, how do you have these conversations? And I'll ask you in a moment as well. This is kind of typically how when I'm referring a client, let's say a client has come to me for nutrition, and I know that they need a therapist. How do you have that conversation? Or also, what we like to do is collaborate with the whole team. So I like to be able to, if the client comes to us and they already have a therapist, they have an MD, they have a psychiatrist, for best care, it's important that I'm in contact with them all. So we're all on the same page. And so this is just a sample script, if it's helpful for people, of how I go about having that conversation with clients, which is verbatim here. In order to provide you with the best care, it would be helpful if I could speak to your dermatologist, your plastic surgeon, etc., so we can all work together to support you. Would you be comfortable with me doing so? So again, if that's helpful for people about how to bring up that topic and ask if it's okay to reach out, so that you can be talking to the dermatologist about, I'm seeing this distress, I'm worried that this client could escalate with more procedures. What are you hearing? What are you seeing? What are your thoughts? I think it's just a really great way to provide the best care for that client. And what about yourself, Dr. Parikh? Are you finding it's fairly easy to have those conversations, given that the stigma around mental health has been, reduced so much?
I am. There's always a small percentage of people who are resistant because they've come here first and they have no idea about other issues.
Right.
But I'll back off if I find that there's resistance, but I hope that they'll come back for, a second checkup on whatever physical sort of condition they have to at least then address it another time. But yes, I think it's very helpful to collaborate.
Absolutely, absolutely. So when it works, and this is an example of actually a real life client at Balance, where the client said that my therapist helped me understand that my appearance concerns were really about other things in my life, which is what we're touching upon today. I decided to not go ahead with the exact procedure I was thinking of, but instead went with something less invasive. I now know it was the right choice for the right reasons. So I don't know about you all, but I think that's an ideal outcome, actually. And have you, it sounds as though you've already answered that question, honestly, Dr. Parikh, with how you go about talking to your clients and really kind of suggesting that, okay, I see that, but maybe this would be beneficial and maybe not that drastic, etc. So I can see you're already doing having those conversations.
I think it's helpful also that back to one of your original slides, our social media engagement is just enough to show that we work, but not enough to induce people into a frenzy through fear. It doesn't seem valuable, and so I'll often ask new patients, I'm like, how do you know us? And if you came through friends and other referral sources, we feel as if that's going to be helpful for us to get to know you. If you've come cold because you somehow saw something on social media, it seems that's another tip off that you can say it's a bit of a flag. Maybe that's one of the flags. Oh, I just saw something. I don't even know who you are, but I've showed up at your office. That's no good. You should want to know if I'm good at what I do. You should have done some research on me first. I think that it speaks to that impulsivity, right? So I think we start to work on that a little bit too through those conversations.
Yeah, absolutely. Love it. And so resources for our people today. BDD is falls under the umbrella of OCD and anxiety, excessive anxiety. So there is an International OCD Foundation that has BDD resources, if that's helpful. There's an incredible book written by Dr. Catherine Phillips for clinicians called The Broken Mirror, which could be a valuable resource for you. And then I just wanted to put out there that once a month, the first Wednesday of every month at 12 noon, I run a monthly supervision group where therapists, RDs, doctors, etc., come together and we discuss difficult cases together. And so I just put that out there as a resource that that may be helpful to you all out there. For yourself, Dr. Parikh, resources that you like to share or would like to share today for our audience.
There's a terrific book that we also recommend, all of us, many of us physicians here at the practice recommend. It's called Buddha's Brain, which is a terrific text. It's beautifully written. There's also an author that I refer to a lot because personally super close to me. I wish I had met him before he had passed away. His name is Dr. John Sarno. Also a great author that speaks to a lot of these ideas about illness, perception. But Buddha's Brain is a very good one. And John Sarno's book is called The Mind-Body Connection, which also speaks to some of these issues as well.
Oh, I love that. That's
We
fantastic.
used to sell it in our office, but we only have so much space on the front counter. So yeah.
I love it. I love it. And we're just putting that in the chat there for everyone to check that out as well. We'll go to our last slide here. So key takeaways in summary about this topic today. What we're hoping we've highlighted is awareness. In other words, screening for BDD patterns, both in your therapy clinics and also, of course, out in different dermatology practices and such, which you're already doing, Dr. Parikh. And we need to be tuned into this because we are seeing an escalation in this. Planning, we spoke about having your referral team set up, knowing who you trust so that you can refer your clients to those said professionals, and then identifying and being aware of recognizing when your client is having distress, and being able to understand what that distress is really about, this perceived appearance flaw, what's really going on underneath of that, and then taking action and prioritizing our clients' well-being over the BDD-driven decision-making, that impulsivity to fix it, make it better, make it go away, which we know actually doesn't provide relief for our clients. And so for you, Dr. Parikh, I'm wondering, what's the most important change that you've made in your practice since becoming more aware and, the social media pieces that we were talking about earlier and with med spa proliferation?
I think that's a great question. I think that because we've always been in this mode, we haven't had to make any drastic changes. I think the issue, is asking more of those questions, right? Like saying, where did you get this information from? And People really do want to have a lot of control, understandably, over themselves. It's a difficult one. I think it's still evolving. Like, if somebody really wants something, how do you say no when it's not medically necessary? It's always a different struggle every week to figure it out, but less and less so because we're so established that we know people understand that when you look at our social media, this is all what it is. We're not going to use fear. We're not going to use that. Um, but yeah, let's see how it goes. I think things are getting more and more difficult with the filters, with the algorithm, to wake up and look at your Instagram and all of a sudden be told what you must do and what you shouldn't do consistently. It's becoming more troublesome even for all I can say is that I do is I try to look at those things less during the week if I can avoid it.
Yeah,
I
absolutely.
advise people to do the same.
Yeah,
Look at it once a week.
yeah,
Like, maybe the same way for example, I don't drink alcohol during the week because I don't want to ever, let alone have it during the day when you're doing Botox on someone, Botox brunches. Don't look at social media. Look at it on Sunday.
yeah.
That's fine. Like, remove yourself from that influence and your brain will hopefully get a little bit better. And hopefully if I do it too, I can do the same thing for them.
Yeah, love that. Love that advice. Thanks so much, Dr. Parikh.
And before we wrap up, I didn't want to have us forget about our continuing education requirements. Your certificate will be emailed within 24 hours of completing these requirements. The link will be provided in the chat and in your follow-up email below. And lastly, I wanted to thank you all for joining us today for this conversation. The intersection of cosmetic procedures and mental health is only going to become more relevant in your practice. Now you're better equipped to navigate these complex situations. Remember, you can always reach out to Balance for consultation and for referral support. So please feel free. You can screenshot the slide for Balance contact information, click to open the links in the chat to learn more, and I'll showcase Tribeca's contact information and references later on as well. And together, alongside Tribeca Skincare and our network of providers, we can ensure our clients receive the comprehensive care they deserve. We look forward to supporting our provider community in finding the best possible care for our clients. I'll have their website and socials in the chat below, and I'll also leave some time to showcase our references here just for your research and your perusal. And please feel free to screenshot these and look into our citations. Let us know any questions, comments, concerns at balanceoutreach@balancedtx.com. Thank you so much. Take care.